Okay, c'est quand même. Tiens.
Please, can we start?
Yes, ma.
No, not at the back.
Okay.
Who's the attendant?
Oh, well, look here. Send.
So, please, let's start. Integrated management of neonatal and childhood illness. So, concept of integrated management of neonatal and childhood illness. So, it's a program.
Where is that list? Attendance list that they are with this one. Who has it? Don't say who is it.
Hey. How come back at you? Hey.
It was estimated that
Not the first, you know.
globally that annual deaths among children under 5 years of age was decreased by 1/3. That is since 1970s. So, although the reduction of this number of deaths
1970.
was not globally, within the 50 countries, within the developing countries, still have a high rate of under 5 deaths. So because of that, there is a program that came up to fight these deaths. So because among these deaths, the major cause of it is malaria, measles, diarrhea, malnutrition, and pneumonia. So this is the major diseases that cause this under 5 deaths. Some of the deaths may be then you should not enter.
John, I'm fine. Good morning. I'm in class.
Malnutrition, diarrhea, measles, malaria,
Only.
and pneumonia. So pneumonia is under the active respiratory infection.
Oh. Wow. There we are. Yeah. Oh, the candles are very good. See that one on the floor now. Oh, the carbon of fuel. Thank you, John. Thank you. Follow me.
So they said that if disease mentioned ago, give account of about 8% of children, death of children under 5. 8%. So, and in Nigeria, about 20% of population of Nigeria are under 5 children. So, and these people are dying every day. The estimation of the deaths is given about 100 deaths per 1,000.
Thank you. Thank you so much. Thank you.
So in Nigeria, about 20% of population are under 5 years. So in this 20% of population, about 30% of children in Nigeria are underweight. So which they are malnourished. About 33.5% are stunted growth, while 9.42% have some deficiency. So in Nigeria and some countries, when there is about 3 children or 4 children that are ill, so you can find out that this disease mentioned as well, at least 2 or 3 children are suffering from this disease like malaria, diarrhea, malnutrition, pneumonia, and measles. So while some children will have more than one symptoms. So you will see a child having symptom of malaria, symptom of pneumonia, symptom of diarrhea at the same time. So if you are treating according to, like you are making diagnosis of malaria, so you may overlook the symptom of pneumonia. So because you are treating one condition, the other one is still there and can end the life of that child. So because of this, they now have combined treatments. So in order to tackle this condition. So because of this, there are many programs that came up to tackle this disease. Control of diarrhea disease, acute respiratory infection program, expanded immunization, the friendly hospital initiative, nutrition, HIV and malaria program. So all these programs now came up in order to fight these conditions. But upon that, the result is not favorable. That still the death of under children are still high. So because in although mothers that bring their child with potential fatal illness at first level of clinic, like health center, clinic, OPD. So all these areas, they don't have adequate way to diagnose a child, like adequate lab radiology, all these lab, radiology, X-ray, ultrasound. So health center, you cannot find it here at outpatient department, at health clinic. So you cannot find it in this area. So the nurses or midwife, the health worker that work in this area, they only depend or rely on the signs and symptoms that child presents to treat that child. So because of that, they now bring up this program, integrated management of neonatal and childhood illness. So this program is now managing the child according to the signs and symptoms, not according to the diagnosis. So when a child comes, we take the history of that child. When you take the history of that child, the program now came up like a chart, look like a standing order. So you know standing order? Yes. Those that work in health center are also
Standing order that is established to follow. Yeah.
So there's a column of signs and symptoms, a column of classified as, and a column of treatment. So when you take the history of that child in that column, now give you what you are going to diagnose that child. So and the treatment you are going to offer to that child. So you are not treating malaria or pneumonia or diarrhea particularly. You are treating both combination, all those signs and symptoms that the child presented with. So it gives you the column of treatment, the medication or medicine that's prescribed there will cover that signs and symptoms, treat whatever that causes it. So, and this program, they did not work alone. They still incorporate with other programs like malaria, HIV. They work together to achieve their goal. So the definition of integrated management of neonatal and childhood illness is a strategy that integrates all available measures for health promotion, prevention, and integrated management of childhood diseases through their early detection and effective management and promotion of health in family and community. So this program, they will treat the child in clinic and still give the mother some medication she will consume at home and advise the mother their diet with vitamin A, iron, and treatment of worm infestation. So lastly, that it encourages each country to develop a clear policy on essential drug for childhood illness. So we have advantages of this program. Accurate identification of illness. So because of this program, you can identify the illness of that child. Another one is more appropriate and combined treatment. Because in this program, you are not treating one symptom, you are combining your treatment to treat all the signs and symptoms that the child presents. It strengthens the counseling of mother or caregiver. Speed up the referral of severely ill child. So, as you are in clinic, when they bring a child that you cannot manage under the health clinic, you refer the child to Kaya Hospital. Yes, good morning. Strengthen preventive services because it encourages immunization. So all those preventive communicable disease, you can prevent it through immunization. And it also gives attention to the health need of the mother. So when the mother brings child to the clinic, as you are managing the child, you still look at the mother. So if there is any problem the mother is having, you still manage the mother. So if the mother is not having any problem, you now advise the mother how she will take care of the child. So we have components of this program. One, that improvement in the case management skills of health staff through the provision of locally adopted guideline on integrated management of neonatal and child care illness, and through activities to promote their uses. Another required for effective management of childhood illness. So selection and use of appropriate case. So these case charts, they are of two types. They have one of age from 0 to 2 months and one of 2 months to 5 years. So when a child comes in hospital, you take a history of that child. So after taking the history, first of all, you ask about the age. Is that age now give you which chart you are going to make use of? Whether it's one of age 0 to 2 months or from 2 months to 5 months, 5 years. So mothers are seen in the clinic with their child when they bring their child. If the child is assessed for that particular problem or particular symptom alone, the caregiver must overlook the other side. As I have said it before, that when a mother brings their child, don't look about the particular symptom. Maybe the mother said that he or she is having malaria. So don't look about that one. You take general history of the child. So in order to identify other diseases that the child is having, other symptoms of the child. Because if you are looking at one diagnosis, you overlook the other side, this is going to affect that baby. Because a child may develop or may present many symptoms. So in this chart, when you take the history, you know the age of the child, and now give you the appropriate case chart you are going to use. So this chart has steps. So it's past 6 steps that we follow. So the first step is assess the child or the young infant and the mother. Second one is classify the illness. Another one is identify treatment. treat the child, counsel the mother, and give follow-up care. So they assess the child is taking history of that child. So that is the assessment. You take all the history of the child, you do physical examination, you send for lab. If there is lab, but if there is no lab, you take history via physical examination. So under classifying the illness, if through the signs and symptoms, the history are taken, you can now classify the illness according to the chart. Because that chart, when you are asking the question, you are ticking it because it's already in that card. You are ticking it. So after you tick, you now know where it falls, the kind of classification your signs and symptoms fall under. So this chart will now give you the treatment you are going to give to that child. Because after you classify the child, you know where the sickness, that is classifying the illness, you know the diagnosis you are going to give that child. From there, you go to the column straight to the column of the treatment. That's why you have identified your treatment, what you are going to give to the child. So treat the child, you now implement, you now offer, administer the treatment and the medication to that child. That is treat the child. So counsel the mother, educate the mother how to go about the child, what she will give the child, what she will do to the child at school, any medication you are going to give the mother to take it at school. You are going to teach the woman how to do it. If it's ORS, you teach the woman how to prepare it and how to give it and when to give it to the child. Then follow up care. You give the woman